Welcome to our webinar, Introduction to Our Services. Medical Billing Professionals has been serving providers nationwide since 1995 with low per-claim fees. What should you look for in a billing service? You want a billing service that provides prompt claim submissions. We guarantee that claims are submitted by the next business day at the latest. You also want a billing service that provides accurate claim submissions. Communication, communication, communication. What we mean by that very simply is if there's any problem with any claims or patients, you want to be notified immediately. You also would like a billing service that has knowledge of your practice specialty with reasonable fees. The specialties we serve primarily are behavioral health, but we also service chiropractic, physical therapy, family practice, geriatrics, and pediatrics. Now, not all practices, though, require the same level of service. Providers should only pay for those services that they need. Therefore, we offer 3 different levels of service: Platinum, Premium Plus, and Premium. The Platinum service includes prompt claim submission. We will also post all insurance payments and patient payments in our Medisoft software. If you are using Therapy Notes and Sessions Health, we can submit claims and post all payments in your EHR. We also will verify insurance eligibility and benefits for any new patients or for patients who change insurance. If you want to know if a patient has met their deductible, for example, for the year, or they're out of pocket, or if their benefits have changed this year, that is an optional service, assuming the insurance is the same. It's $11.95 per verification. We also include under our Platinum service follow-up of outstanding claims and claims that deny an error, authorization tracking, a detailed claim submission report. This level of service is only available for behavioral or mental health practices. For any other specialty, such as chiropractic or physical therapy, you will want to enroll for the Premium Plus service. The Premium Plus service includes the prompt claim submission and the posting of all payments, as well as the detailed claim submission report. We also provide you a detailed primary insurance aging report showing open claims that were submitted at least 30 days ago. Verification of benefits is optional under the Premium Plus service for $11.95 per verification. Authorization tracking is also optional, and follow-up is on demand. You have to request that we follow up on certain claims, and it's $12.95 per follow-up for each claim we follow up upon. For the Premium Plus service, this is the prompt claim submission, detailed claim submission report. Authorization tracking is optional. Verification of benefits is optional. But this level of service is designed for practices that are out of network with all payers. Insurance payment posting is not included, and follow-up of outstanding or denied claims is not available. This is a sample primary claim submission report sent to you from our Medisoft software, and this is a sample primary insurance aging report sent to you, broken down by insurance, by payer, by claim, and you can easily follow up on claims yourself. The Platinum service fees, the standard rate is $3.99 per claim, with a minimum fee of $199.95 per month. A 1,000 claim annual prepayment option is $3.65 per claim. A 2,000 claim annual prepayment option is $3.35 per claim. With an annual prepayment option, the number of claims purchased must be used within 1 year. We do offer again the optional verification service. If you want us to verify benefits for existing patients with the same insurance, remember, if it's a new patient or the patient changes insurance, that is included. The optional here is $11.95 per verification. In addition, there is a limit of 60 insurance verifications per month for new patients or patients who change insurance. If you exceed 60 during a billing month, there is a fee of $11.95 per each additional verification. There is no setup fee. This level of service again is only available for mental health practices. For the Premium Plus service, the standard rate is $2.89 a claim with a minimum fee of $99.95 per month. A 1,000 claim annual prepayment option is $259 per claim. A 2,500 claim annual prepayment option is $219 per claim. Again, the number of claims purchased must be used within 1 year. Again, with the on-demand follow-up service, it's $12.95 per claim that you request we follow up upon, and the verification of benefits is optional for all patients, $11.95 per verification. Again, no setup fee. For the premium service, the standard rate is $2.45 per claim with a minimum fee of $69.95 per month. A 1,000 claim annual prepayment option is $2.15 per claim. A 2,500 claim annual prepayment option is $1.75 per claim. With the annual prepayment option, the number of claims purchased must be used within 1 year, and again, no setup fee. Are you using a billing service charging a percentage? If so, you are probably overpaying. Most billing services charge between 5 to 10% of the amount paid, with the average being 7%. If you are paying 7% and your average reimbursement is $80 per visit, you are paying $5.60 per claim. Compare that to our highest fee of $3.99 per claim for our Platinum Service standard rate. If your average reimbursement per visit is more than $80, your savings by using MB Pros is even greater. For example, if your average reimbursement is $120 per visit, you would pay $8.40 per visit to a billing service charging a percentage compared to a maximum of $3.99 per claim with MB Pros. If you group visits together by patient, you can save. For example, if you submit visits for John Smith for April 1st and April 8th on April 15th, and let's assume you are reimbursed $80 per visit for a total of $160. If you paid 7%, you would be paying $11.20 for those 2 visits. If you are enrolled for our Platinum service, you would pay a maximum of $3.99 for that claim. Now, a billing service charging a percentage will argue they fight hard to get your claims paid. In reality, follow-up is needed on only 2 to 5% of claims, depending upon your specialty. If you submit 100 claims during the month, you would be overpaying on the 95 to 98 claims that are processed without any need for follow-up. And if you visit mbpros.com/save, you can calculate how much you can save by switching to MB Pros. So, how do you submit billing to us? Most practices submit patient information and billing via our secure online forms on our website. If you are using one of our preferred EHR partners, IconNotes, Practice Fusion, ChiroTouch, ChiroFusion, and WebPT, we can obtain patient demographics and billing from those EHRs. We do not bill in those EHRs. We can obtain the information and enter them in our Medisoft. If you are using Therapy Notes or Sessions Health, watch our on-demand webinar, Need Help Billing in Sessions Health or Therapy Notes. In that webinar, we explain our services with billing inside of Sessions Health or Therapy Notes. If you are using any other EHR, most programs will allow you to print a report of patient demographics and print a billing report providing us the required information. We do have an introductory special for winter of 2026. If you register for our Premium Plus or Platinum Service standard rate, you will receive 2 months free with the standard per claim rate with a limit of 100 free claims per month. Note though, it is months 3 and 4 that are free, not the first 2 months. You also will save 10% off our standard per claim rate for the first year, and you'll save compared to a billing service charging a percentage. So you will pay only $262 per claim for the Premium Plus service, little typo there, with a minimum fee of $89.95 per month. If you're choosing the Platinum service, you would pay only $359 per claim with a minimum fee of $179.95 per month. So you're saving also off the minimum fee. If you want to prepay and save, if you purchase any annual prepayment option, you will save 20% off all prepayment purchases for the first year and receive up to 5 months free and save. So for the Premium Plus service, if you purchase 1,000 claims for $207 per claim, you will receive 3 months free. If you purchase 2,500 claims for $1.75 per claim, you will receive 4 months free. With the Platinum service, you'll purchase 1,000 claims for $2.92 per claim, receive 3 months free. If you purchase 2,000 claims for $2.68 per claim, you will receive 5 months free. The 1-year time period for using the number of claims purchased begins after the month's free, and there's a limit of 100 free claims per month. Our winter special does expire March 31st, 2026. We also offer a 30-day money-back guarantee for any prepayment purchases. Ask us for details, or you can visit the money-back guarantee page on our website. Now, if you are not using Therapy Notes or Sessions Health, we will be submitting claims via the ClaimMD Clearinghouse. We provide you the opportunity to access the ClaimMD portal to view all claims submitted by us with the status of those claims. You will view ERA files, electronic EOBs. When searching for a claim, if the claim was paid by ERA, you will see the corresponding payment for that claim. And you also could run eligibility and benefit requests for your patient. ClaimMD will bill you directly for the plan that you choose. You can choose from 3 options: unlimited, small volume, or basic. For detailed ClaimMD pricing, visit claim.md/pricing. If you are under our Premium Plus or Premium service, you do not need access to claims and ERAs. You can choose the no portal option. It is $16.95 a month if you do not want access to the portal. That does conclude this webinar. Again, remember, for our introductory winter special, visit mbpros.com/2026 special. You can email us at info@mbpros.com. You can call us at 877-762-7767. You should also view the references page on our website to see more than 40 references nationwide you can contact. There is no long-term contract to sign. And again, if you want to calculate how much you can save by switching to us, go to mbpros.com/save and use our interactive form. And finally, if you want to meet virtually to discuss our services and our introductory special, you can schedule your meeting at mbpros.com/virtual. Thank you.